begin.
Hello everyone, and welcome back to my show. I'm Dr. Locke from Acupuncture is My Life. Now in this episode, I plan to talk about asthma and the common cold. Now I've had an interesting chat with an individual last night who has asthma and is very concerned about the upcoming cold season while in the midst of this COVID-19 pandemic. Now for those who are unaware, Acupuncture is My Life has an app available for those who are interested in having a private chat regarding any ailments or concerns you or a loved one may have regarding acupuncture. Now on this app, you can also learn more about acupuncture, Chinese herbs, and plant enzymes as well. So when you get a moment, go to the Google Play Store to download the app onto your Android device. Now back to the discussion which I'd had via chat regarding asthma and the common cold. Now for those who lack a basic understanding as to what asthma is a respiratory condition which is marked by spasms in the bronchi of the lungs, making it difficult to breathe. It usually results from an allergic reaction or some other form of hypersensitivity. Now, as I discussed with the individual in my chat session, if you have asthma, catching a cold can worsen the symptoms of this disorder, so you'd want to avoid any flare-ups during cold season. Now, asthma is generally associated with inflammation of the bronchial tubes, which are located in the lower airways of your lungs. Now, colds are basically as a result of an infection with a virus which mainly affects the upper airways. You see, during normal breathing, muscles that surround the airways are relaxed, allowing air to move freely throughout. Now, when someone experiences an asthma attack, the surrounding muscles tend to tighten, narrowing these airways. Now, this is called bronchospasms. The lining of the airways become inflamed, and the cells that line these airways begin to produce excess mucus. Now, when you combine bronchospasms with inflammation of the lower airways and excess mucus production, asthmatics begin to experience symptoms such as difficulty breathing, coughing, and wheezing. Now, combine that with the common cold as a respiratory infection caused by a virus. The impact of the common cold on asthmatics' bronchial tubes can lead to wheezing and tightness in the chest. Now, the common cold can cause asthma flare-ups, especially in young children. So, of course, I was asked, how would an acupuncturist diagnose asthma? In which I'd inform this individual that as an acupuncturist, asthma is seen as a disease of an exterior pathogenic influence triggered by latent phlegm in the lungs. In Chinese medicine, phlegm is the primary cause of an asthma attack because this phlegm obstructs the lung's ability to distribute and disseminate fluids. Now, phlegm can also obstruct the spleen's ability to transform and transport fluids. This latent phlegm that exists in the lung can trigger an asthma attack as a result of weather change, which impairs the dispersion and descending functions of the lung qi, therefore manifesting as wheezing, breathlessness, chest congestion, and productive cough, just as in Western medicine. Now, I had a wheezing case earlier this year where the patient presented with rapid breathing, a feeling of oppression of the chest with cough, scanty phlegm, a desire for warm drinks, constant feeling of cold with a slight bluish white complexion. Her tongue appeared swollen with a sticky white coating, and the pulse had a tight, slippery texture to it. This was apparently a case of like cold phlegm, where I knew I had to warm the lungs, scatter the cold, resolve the phlegm to relieve the breathlessness. So in doing so, I needle points on the lung and bladder channels to restore the descending of lung qi to stop the wheezing and breathlessness. Now I needle points on the conception vessel to restore the descending of lung qi, resolve phlegm, and move qi in the chest. I also needle points on the stomach and pericardium channels to resolve phlegm and relieve breathlessness by opening up the chest. Now, she responded pretty well to her initial as well as follow-up treatment sessions, and I also advised her to keep in touch with her physician, or rather keep her physician informed as to her progress. Now, a little side note, there can be two phases of asthma relative to clinical manifestations, which can be, let's say, an acute episode where there's phlegm obstructing the lung, which can follow either a wind cold or a wind heat pattern, whereas the primary symptoms would be wheezing, as in the case that I just discussed, and there would also be breathlessness with hunched shoulders and a cough. Then there can be chronic, or there could be like a chronic remission phase, where in this case, long-standing asthma transforms from an excess to a deficient pattern. In this case, the deficient lung qi failing to distribute fluids usually results in the formation of phlegm. In this phase, there are usually signs of kidney or spleen deficiency, where a deficient spleen generates phlegm, adding to latent phlegm in the lungs. And when it comes to kidney deficiency, it's usually as a result of kidney yang failing to metabolize fluids, which can also lead to phlegm formation. Now, pronounced symptoms as a result of these deficiencies can be shortness of breath, fatigue with a constant mild wheezing, So listen, there's no sure way to keep yourself or your child from catching a cold for that matter. But taking steps to avoid getting sick can help, such as avoid contact with anyone who is sick, wash your hands often, avoid touching your eyes, nose, and mouth, and not share your inhaler or other breathing equipment with others. Those are just some of the actions that you or your loved one can take, along with remaining in close contact with your physician and acupuncturist to avoid catching a cold if you're an asthmatic. Now, don't forget to download the Acupuncture's My Life app from the Google Play Store to engage in private chat sessions regarding acupuncture, as well as learning more about Chinese herbs, plant enzymes, and more. Also, subscribe to this channel to receive notification as to when new episodes are posted. And until next time, acupuncture is my life. What's yours?